Hello everyone. Today we are going to discuss about hemodynamics and the topic of edema and effusion. So what is edema? Edema, or we can write as edema. Edema is accumulation of fluid in interstitial tissue. And what is effusion? Effusion is accumulation of fluid in body cavities. Body cavities like peritoneal cavity, pericardial cavity, pleural cavity. So edema is accumulation of fluid in interstitial tissue and effusion is accumulation of fluid in body cavities. So how will it work? So this is the blood vessel. There are two kind of pressure. One is hydrostatic pressure, which allows fluid to go outside the blood vessel, and other is plasma oncotic pressure, which allow or favor fluid inflow inside the vessel. So main factor for plasma oncotic pressure is plasma protein, particularly albumin. And for hydrostatic pressure is fluid volume inside the vessel. The more is the fluid volume is inside the blood vessel, it results into the leakage of fluid or outflow of the fluid from the blood vessel, and increased level of albumin result into the more and more retention of fluid inside the vessel. Now we will see excess fluid in interstitium and its flow. Excess fluid in interstitium drained by lymphatics, and lymphatics drain into thoracic duct, thoracic duct drain fluid into the left subclavian vein. If is there any obstruction in this flow at level of lymphatics or thoracic ducts or subclavian vein, it ultimately result into the accumulation of fluid or may result into the edema. Now we will see the causes of edema. Causes of edema. So edema can be due to increased hydrostatic pressure, or it can be due to reduced plasma oncotic pressure, or it can be due to lymphatic obstruction. Another cause of edema is inflammation and sodium retention. These are the 5 broad causes of edema. Now we will see one by one. First is increased hydrostatic pressure. So as we know, when fluid inside the vessel fluid increase, it may result into the hydrostatic pressure, and this can be a result of impaired venous return or arteriolar dilation. Impaired venous return can be seen in congestive heart failure or venous obstruction due to thrombosis or any pressure obstruction of the vein. Constrictive pericarditis, ascites is accumulation of fluid in peritoneal cavity or abdominal cavity, or prolonged inactivity which result into the decreased tone of the muscles and ultimately result into the impaired venous return. On the other hand, in arterial dilation or dilatation, which can be seen in exposure to heat or in neurohumoral dysregulation. So these are the causes of increased hydrostatic pressure. One is impaired venous return and arteriolar dilation. Both of them are result into the increased fluid amount inside the vessel and ultimately causes increased hydrostatic pressure and promote fluid movement outside the vessel. Now we'll see the second cause of edema, which is decreased plasma oncotic pressure. As we have discussed, this is mainly due to the plasma proteins. So this is seen in hypoproteinemia. Now, a number of conditions can result into this hypoproteinemia or decreased plasma oncotic pressure, namely nephrotic syndrome, in which proteinuria occur or we lose protein by kidney. Other condition is liver cirrhosis, decreased synthesis of protein by liver. Malnutrition, decreased dietary intake of protein, and protein losing gastropathy. So these are the condition in which we see a condition of hypoproteinemia and ultimately result into the decreased plasma oncotic pressure, and this allow fluid to go outside the blood vessel and result into the accumulation or edema. Now the third condition is lymphatic obstruction. Lymphatic obstruction, as we have discussed, when a fluid accumulates into the interstitium, it drains by the lymphatics to the thoracic duct and ultimately into the left subclavian vein. When is there any obstruction of lymphatics, which can be due to inflammatory condition, neoplasm, as neoplasm metastasized to the draining lymph nodes, post-surgical condition, or post-irradiation. So these are the condition can result into the lymphatic obstruction and ultimately result in fluid accumulation. The fourth condition is sodium retention. Increased sodium intake with renal insufficiency and increased renal tubular reabsorption of sodium, which result into which is seen in renal hypoperfusion and increased renin angiotensin aldosterone secretion, which ultimately result into the retention of sodium, and along with sodium there is a retention of water. Another cause of edema is inflammatory conditions. There can be acute inflammation, chronic inflammation, or angiogenesis. In angiogenesis, there is a process of neovascularization or synthesis of new blood vessels. They are leaky in nature and allow fluids to go outside the blood vessel and result into the accumulation of fluid into the interstitial tissue. So these are the causes of edema. First is increase hydrostatic pressure. Second is decreased plasma oncotic pressure due to hyperproteinemia. Third is a lymphatic obstruction. Fourth is sodium retention, and fifth is inflammatory conditions. Now we will discuss about the mechanism of edema, how edema develops. In heart failure or right side heart failure, in congestive cardiac failure, there is increased capillary hydrostatic pressure due to impaired venous return, and the second is decrease renal blood flow due to cardiac failure. So increased hydrostatic pressure directly result into the edema development. Decreased renal blood flow will activate renin angiotensin system, which result into the retention of sodium and water. Which ultimately result into the increased blood volume and causes edema. On the other hand, renal failure will also causes retention of sodium and water and result into the increased blood volume and ultimately edema. Now we will see the other causes of edema as malnutrition, in which decreased intake of protein, In liver cirrhosis, decrease hepatic synthesis of protein, and in nephrotic syndrome, increase excretion of urinary excretion of protein. All of these conditions will result into the decrease plasma albumin and result into the decrease plasma oncotic pressure, ultimately result into the development of edema. So these are the mechanism responsible for the development of edema. In next lecture we will discuss about the congestion, hyperemia, and the normal mechanism of hemostasis, how hemostasis develop in the body. Thank you.